Hi, this is Dr. William Curtis with Future Focused Family Medicine and NRG Tribe. Today I want to talk to you about a medical situation, symptom if you will, that I run into on a regular basis. That is fatigue. Fatigue is something that I have so many people that come into the clinic on a regular basis and complain of some version of fatigue. Generally, I refer to fatigue as not necessarily sleepiness, but more a symptom of general bodily fatigue, lack of motivation, a sense of extreme tiredness. These are all kind of things that kind of fall into this category. So one of the things I want to do is probably this will turn into a 2 or 3 part series where I want to break it down into sort of mind, body, and maybe spiritual reasons that people develop fatigue. And I also want to give that caution that sometimes fatigue, we jump to conclusions about fatigue. In other words, we just assume that, oh, I'm very tired. It must be because I don't sleep enough, or it may be because maybe I'm anemic, or maybe I have an iron deficiency or something like that. People make a lot of assumptions because of the broad nature of why people have fatigue. So in this situation, I want to start with the body system kind of reasons for fatigue. And I want to also throw in things that maybe help you understand what things you should rule out. In other words, don't jump to conclusions, start ruling some things out so that we can identify the most likely reason for your particular condition. So to start with, let's talk about these bodily issues that can occur. First off, fatigue is a very common symptom of numerous physical issues. Some of those can be very disease-driven, thyroid conditions, diabetes, anemia, cancer, and various other systemic autoimmune disorders all have fatigue as a general feature. Also, when people can't sleep well, which kind of overlaps a little bit with mind and body to some extent, but poor sleep will suppress immunity, make you more prone to infection, make you more prone to all kinds of other immune dysfunctions. That can, primary symptom can be just ongoing general fatigue. Also diet. Diet's part of how we fuel our body. If you eat a very high processed sugar diet, if you drink excess or alcohol or caffeine or stimulants or monster drinks or these types of things, you're going to be much more likely to have a general sense of fatigue. If you need a stimulant to get you feeling normal again, ironically, that stimulant is probably leading you to feel fatigued to begin with. And so in turn, part of the solution, and I will get to solutions, will be to improve those aspects of how you fuel the body. Another that has a bodily component that can lead to fatigue is stress. Now, I probably spend 30% of my day with patient care dealing with and working with patients on how identifying and also treating how stress affects them. Now, again, these overlap, mind, body, spirit. Stress certainly affects the mind and spiritual realms, but for the body, it creates an actual chemical response. And I've talked about this in other articles in the Energy Tribe. You could certainly look under articles related to stress in the search box on Energy Tribe. I have talked about how stress, whether it be pain, bad nutrition, social, emotional, physical stressors, financial stressors, anything that sort of causes us distress will cause our cortisol levels to rise inside of the adrenal glands. Basically, it's preparing us for a fight or flight. When that happens, when cortisol rises, that has a series of effects through the body. Those effects are beneficial in the short run. They prepare us to either defend ourselves, they boost our immunity temporarily, and they make us hypervigilant and ready to tackle something. But if it goes on too long, that actually suppresses our immunity, causes dysfunction in our overall immune system, and it uses up our resources that we normally would use to decrease inflammation or repair or build hormones or sex hormones or growth hormones, things like that. So what happens is people that have chronic stress begin to have a series of declining physical features. One of those is fatigue. Okay? So regarding the physical aspect, if you go into your medical doctor and said, I am really tired, I'm just run down, I don't understand why, here are the things that I would list under a workup that I believe should be done to make sure that you're kind of checking off all the right boxes, to make sure you're not missing some major disease, and to make sure that we're starting to arrive at the proper diagnosis for your condition. Those things would be basic blood work. These might include a complete blood count, a CBC, a complete metabolic panel. I like to get a sedimentation rate. That's an ESR. It's a marker of inflammation. I like an autoimmune antibody panel. Also a thyroid panel, including a T3 and a T4. A hemoglobin A1C, which is my diabetic patients know is a average blood sugar test. I also like to do a diet survey, and this is a quick 1-week survey where maybe you take a picture of your food that you eat every day, write those things down, and take a general assessment of how you're eating and how that might be contributing to fatigue. I also like to know about sleep. Sleep is terribly important for the body. You should be getting 8 to 9 hours of sleep a day. If you're not, that may be why you're tired or having fatigue. I also like to ask about sleep apnea, including the total amount of sleep, how consistent that is, and does it bump on at least 8 hours of sleep on a regular basis. And as a sidebar, I will mention I like to use watches like Fitbits and things like that that monitor sleep. I think these are becoming very valuable technology that can give you fairly accurate assessments of what your sleep is doing day after day, week after week. And if you, let's say as an experiment, you think I'm tired because of my sleep, you objectively increase your sleep and you notice vast improvements in your energy, then you can rest assured that's probably what's going on. I also like to review medications. Keep in mind many medications for mood disorders, anxiety, depression, and many pain medications and muscle relaxers. These types of medications are very much associated with fatigue. You can be in really perfect health from a bodily standpoint, physically, but the reality is the medicines and their hangover effect that they have when you're taking them and the neurologic effects that they have could potentially be causing you to be tired all the time. So I'm not saying go stop all your medicines or anything. I'm just saying that if you want to look at this as a complete picture, how am I going to be objective about why I have fatigue? Blood work, diet surveys, sleep assessments, medication review. So that would be, I think that's going to where I'm going to hold up for the first video. Keep these fairly short but meaningful and impactful for you. One of the things you should do is be ready to change these things and get these evaluations done. If you don't, you're guessing about fatigue. You're simply guessing. And in medicine, there's too many things that it's too complicated to simply say, oh, it must be that, and then you continue with the same symptoms. So I hope that makes sense. I hope you'll follow this series. I'll be putting the next out in the next few days, which will talk about sort of the mind reasons that and body and spirit reasons that a person can be fatigued, and then ultimately we'll talk about my ways that I like to convince people to treat each of those sections. To summarize this section on physical or bodily causes of fatigue, besides identifying the reason, which we talked about, I would suggest that people try to get 8 to 9 hours of quality sleep. I would recommend that they walk or take some type of basic aerobic exercise, 30 to 45 minutes, 5 days a week. And I would carefully review with your doctor any sign, any labs, and rule out medication side effects as a cause of fatigue. I hope that all makes sense, and I hope this has been helpful for you. Please leave a comment if it was. Leave questions. I'll do the best I can to answer those. And I will look forward to talking to you again regarding the body and mind and spiritual causes of fatigue. Take care.